Pamela Cacchione is a professor of Geropsychiatric nursing at Penn, nurse scientist at Penn Presbyterian, and CEO and founder of Aging Sense, exploring low-cost robots to enhance function and social engagement for older adults. Dr. Mark Yim is the ASA, do I pronounce it like that? ASA, sorry. Is the ASA Whitney Professor of Mechanical Engineering at Penn, a pioneer in modular robotics, faculty director for integrated product design, and co-director of Penn 4C, leading a new initiative in responsible innovation. So please, welcome Dr. Pamela Cacchione and Dr. Mark Yim.
Welcome, everyone. How many engineers in the room? Great. Any nurses in the room? Awesome. Welcome, welcome. We're so excited you're here. So Dr. Yim and I have been working together for about a little over 10 years now and have had quite a few really fun adventures that we'd like to share with you. And just a little bit about gerontological nursing. We have, that's right, slow. All right, so we focus on the health and well-being of older adults, basically. And it's really, we're even expanding now to thinking about impacting aging from an earlier age as from birth to death. So really thinking about how do you address aging in a more positive way and thinking more about function and quality of life. And so we really work in the community a lot. I have a nurse scientist as well in a health system, but I also work in the community to address community health concerns. And we really focus on health equity in all of our research and in our science, as well as equitable design. And I've learned a lot from Dr. Yim along the way, so it's been a lot of fun. And we'll pass it off to him to share what he does.
I was, just to give you a little bit of background where I come from.
A little closer.
Let me just get some videos. I'm going to try to go a little bit quickly since we're running a little bit behind. I used to run the GRASP lab at UPenn, which is the oldest robotics research lab in the country. It's got about 25 faculty and 400 students that are involved. So we have a large group that are working on a variety of different things. 3 months ago, I stepped down from that and took over a new effort that we're calling responsible innovation. So responsible innovation essentially is getting engineers to start thinking about what happens as a consequence of what we do, maybe beyond what we are trying to do in terms of succeeding. What could go wrong if we succeed? As we start to look at AI and everyone's worried about the bad things that may happen with AI, this really relates to what Gloria Bell just talked about previously. How do you make sure that what you're doing is inclusive for everybody, that you're not harming unintended to society and that type of thing? And so right now we're just starting that and we're trying to figure out how can we address things that might harm people, but at the same time, how can we do positive things? So doing things like things that might help the community. These are some other robotics projects from my lab, which include large robots. So we have the smallest robot in the world. We also have maybe the largest robot in the world. This one is one that can go into a damaged building for first responders and grow to be, and it wasn't quite, that one was a mistake. It was the first test, but it's supposed to grow large enough to actually support a building if the building is damaged. Usually when firefighters go into a burning building, they have to build structures to make sure it doesn't fall on them as they go in, so we instead want a robot that can do that. On the other left side, there's an image of a steerable needle, so medical devices that can go in and steer around in your body instead of having to just go straight. So those are the types of things we're looking at. And essentially, the thing that we want to talk about between Pam and I are how can we get nurses and engineers to work together, bringing technology to those health type aspects.
So one of our first projects was an NSF-funded study that used a commercially available robot, Relay. Some of you may have seen one in a hotel doing room service, to apply to elder care, to try and determine how this could possibly be used with older adults. So we ran focus groups with clinicians, OTs, PTs, nurses, physicians, social workers, as well as paid caregivers and then participants of a life center, living independently for elders. And in Philadelphia, the School of Nursing used to own and operate a life program, so that's where we started. And what we found out is we have to really set the stage of what the expectations are. So when we asked them what they wanted the robot to be able to do, they said pick the patient up off the floor after they've fallen. Well, a low-cost mobile robot isn't going to be able to do that. So we had to backpedal a little bit. So it sounds like it would be better if we actually prevented falls. And so we created this robot to perform tasks that would improve their ambulation status. So we did a walking and hydration task, and we had a robot whisperer that taught this robot to learn the environment and had it independently going up to patients' rooms and fake knocking with a loudspeaker on their door to invite them to go for a walk in their apartment building. This was a failed experiment. It failed because the robot, even though it had learned and we had programmed it not to get too far ahead, it did get too far ahead of the older adults and would spin around and startle the older adults almost to the point of them falling. And then the older adults were also tired when they got back home from the life program and really didn't want to go out and walk again and what have you. So we really didn't get as great participation. So we went back, so it encouraged them to walk and then offered them hydration. And so we went back and did a Wizard of Oz version. You might be able to see Kaio in the blue, who's actually driving.
Robot.
We need the sound, yeah.
I see you. You are the bomb, Mr. Robot.
Okay, I think here is perfect.
Okay.
It was a great walk.
You was great being.
So it's gonna offer you water. You just turn.
Well, that's about the only thing, because I don't drink.
Do you like some water?
Yes.
Yes. Just
It's not no strong water, is it?
no, just
I
normal
just
water.
messing with the robot.
Yeah.